Hey, it's Dr. Gio here. Just want to give you my perspective on the recent podcast interview with Peter Attia and Dr. Ted Schaefer. Dr. Ted Schaefer, an excellent, well-known, world-renowned urologist and chair of Northwestern Urology. There are a couple of things that I want to clarify because many of you are asking me questions about different parts of that conversation. Number one is on HOLEP. HOLEP is a procedure for an enlarged prostate. There are many procedures for an enlarged prostate. He promotes HOLEP because of Dr. Hackenberg. I'm probably butchering the name, Amy, first name, who's a urologist at Northwestern who apparently does this procedure. Excellent procedure. Soon, the Dr. Gio podcast will have Dr. Dan Gralnick, who is an expert on HOLEP from the University of Wisconsin. And we're going to talk about HOLEP. Excellent procedures. There's many out there. It's not the only one. There's aqua ablation. There is Resume, there is green light laser surgery, all sorts of approaches to opening up the prostate to help men urinate. That's number one. Number two, Dr. Schaefer in the Peter Attia podcast, The Drive, he talks about a couple of tests that I don't use as much. He talks about the 4K score primarily as a blood test as a little bit more sensitive and specific to prostate cancer than PSA. And this is, of course, true. It is. If you have nothing else other than PSA and or 4K score, then you want to get a 4K score on a patient to determine the possibility of them needing a biopsy for prostate cancer. However, I don't use nor recommend the 4K score as much because if we're saying that the PSA biomarker is a problem, if it's not so sensitive and specific to prostate cancer, then the PSA test is one of the 4Ks, callicrins, use in the algorithm to come up with their number, with their final number. So what I've noticed with the 4K score, for example, is that men with BPH who have a high 4K score suggesting that they have prostate cancer and they should get a biopsy, oftentimes that high 4K score is because they have a big prostate. And it's for benign reasons. So then they'll give you a false positive. So that's why I prefer a urine test or any other urine tests available. One is the SelectX test, which is a non-PSA test, is a genetic test to determine if indeed you have prostate cancer that we should pay attention to and then get a biopsy. Number two is the Exosome DX test, which again is a non-PSA urine test. One requires a prostate massage, the Select MDX test. The other one does not, the Exosome DX test. Either of the two are non-PSA based, and I prefer one of those two better than the 4K score. Once again, they do not require a PSA biomarker, a PSA value to determine their final number. Lastly, prostatitis. Dr. Schaefer didn't talk a lot about prostatitis in the Peter Attia, but he did mention that they're looking into the potential of mast cells involved in non-bacterial prostatitis, which is most prostatitis. Most prostatitis is non-bacterial. My perspective on prostatitis is the following. Most, yes, is non-bacterial, non-infectious. I believe that prostatitis is a neuropathic condition where it starts from the central nervous system right down to the prostate, where it causes tightness of the prostate. Remember, the prostate is 30% muscle. So there's tightening of the prostate, tightening of the pelvic muscles, and that causes all kinds of dysfunction, discomfort, and transfer pain to the pelvic area, whether it's between the scrotum and the anus or the penis or what have you. So prostatitis is very tricky as a diagnosis of exclusion. It's very hard to diagnose, but there are many men out there that are typically type A personality types, let's say, or if you sit down for prolonged periods of times, these things are typically associated with prostatitis or prostatitis symptoms. So I just wanted to give you my quick review of the excellent podcast on The Drive with Dr. Ted Schaefer with Peter Attia. My podcast tends to be more of a deep dive into different elements of prostate cancer and diagnosis of prostate cancer and treatment options. This podcast with Peter Attia and Dr. Ted Schaefer was an excellent overview, and I recommend for you to listen to it. This is Dr. Gio signing off. Talk to you next time.